Safe patient mobilization, how to complete a mobility assessment. In this video, you will learn how to complete a mobility assessment. It is important that you do not provide any physical assistance to your patient during the exercises. You are trying to determine whether your patient is independent, needs minimum assistance, moderate assistance, or is a maximum assist. The following exercises will help you make that determination. If your patient feels nauseous, dizzy, or lightheaded at any time, stop and address those concerns before proceeding any further. We will be using the mobility level assessment algorithm to assess the patient. The first part of the assessment is to assess your patient's lower extremity strength. Do this by asking the patient to raise their legs one at a time. If your patient is able to do so, move on to the abdominal strength test. Have the patient bend their knees and place the bottoms of their feet on the bed as shown. The patient will then place both arms on the bed at their sides and raise their hips off of the bed. This patient has good abdominal strength. If your patient has abdominal strength, ask the patient to sit at the edge of the bed and place their feet on the floor. They may use the side rail if needed to push themselves up, but they must be able to do this on their own without your help to be considered independent. Have the patient stand straight up without leaning forward. Notice how Duncan provides a supportive stance and hand just in case the patient leans forward. If your patient is able to do this without assistance, have them march in place. Stand close by to make sure they do not fall. If your patient was able to complete all of these exercises without your assistance, they are independent with their mobility. Make sure you don't forget to chart your mobility assessment. Now let's see what happens when the patient is not independent. If the patient is unable to lift their legs or roll from side to side, they are a maximum assist. This patient is a maximum assist. He will require a bedpan for toileting, the use of an air transfer device such as a hover mat, or other friction-reducing devices such as a slip sheet. For other larger movements and repositioning, mechanical lifts and slings should also be utilized. If the patient is able to sit at the edge of the bed on their own, but is unable to stand up on their own, they are a moderate assistance. Notice how Duncan does not allow the patient to pull on him or use his body for assistance. Do not allow yourself to become injured. This patient is a moderate assist. He will require a sit-to-stand device for transferring or a seated sling. The sit-to-stand can be used to transfer him to a bedside commode or the restroom. Remember, if the patient is unable to sit at the edge of the bed safely, they cannot sit on a toilet or a commode safely. If the patient is able to stand but cannot march in place or needs an assistive device for balance, they may use the assistive device. This patient is a minimum assist. If they still have an unsteady gait with the assistive device, consult physical therapy, and never let the patient ambulate unsupervised. Use a transfer device such as a sit-to-stand for the patient who is wobbly on their feet. Remember, if the patient needs any help, use equipment, not your back. Doing what Duncan is doing here is a back injury waiting to happen. Remember STAR. Stop. Think about the movement you are about to perform. Act and get the appropriate equipment. Review the patient mobility algorithm. For any questions, please contact Duncan Herda, Safe Patient Mobilization Coordinator.